Welcome everybody. This is a very exciting day for the Dartmouth General Hospital Foundation and the Dartmouth General. Today is a big milestone for the Dartmouth General Hospital redevelopment as we take the transition into Nova Scotia Health for the new PACU and for our new day surgery unit. A very exciting day. A big thank you to our donors. We could not have done this without you. The equipment that you've helped fund, you'll see on the tour. But here we are today during COVID, and we'll provide a sneak peek of the behind the scenes just before we open our new PACU and day surgery. So, without further ado, I'd love to introduce Dr. Todd Howlett and Chris Underhill, who will give us a special behind the scenes guided tour for your benefit. Thank you again for your support, and enjoy the tour.
Hi, Stephen. Thanks so much. And Chris, you want to? I guess we're going to stand 6 feet apart. So. Thank you, and it's great to be with you guys again. I just wanted to say this is another important part of the Dartmouth General redevelopment, and we're excited to be standing right now. Chris, I think this is our day surgery. That's what it says up there, so I guess we better call it day surgery. And if you were to come for surgery at the Dartmouth General, you will now come to this place, and you'll be entering into our brand new ORs through a different space. So. And we're going to open this on very shortly. So we're doing this on it'll be Monday when you see this, and people will be streaming in, I suspect, at that time. So Chris, do you want to talk a little bit about what will happen after people come here?
Yes, I will. So when the patient comes through the door, which I believe is going to be there, eventually there's going to be a glass wall, which I believe isn't going to happen for a couple of weeks because it's not ready. But they'll come up to the desk, and our clerical people will be here. They'll put your armband on and call back to the day surgery desk, and the nurse will come out and get you. And then we will proceed into the day surgery door.
Yeah, so we often call an area called day surgery, which is the area that you come into to get undressed, speak to your surgeon, and he's just before your OR. And then from there you go into the OR. So we'll go there next. Note that along with our tour, we'll introduce later, is we have Dr. Scott Maudsley, who's the site chief of surgery, and we have Gordon Peckham, who's the new director of the Dartmouth General. But we're standing in front of, I think, 3 consultation rooms. Is that right, Chris?
That's correct. They're 5 consult rooms, so if the surgeon wishes to have a conversation with the patient that he doesn't want everybody to hear, they can use one of these rooms to talk to the patient and their family. That's what we had anticipated they would be used for.
Yeah, so this is one of those important steps that we did to focus on patient and patient experience and the like. And this was our patient engagement to say it's important to have a place that you can talk to people about surgeries, either pre-operatively or post-operatively. There may have been findings during a surgery that the surgeon would want to discuss with the patient afterwards, and we now have a comfortable, confidential space to do that. Again, so I think this is Chris and I, and this is from, we call this a pre-operative room. So Chris, maybe you could explain what would happen if I were to come into surgery today and what this room would be for.
So after you've come through the clerical desk, the day surgery nurse comes and picks you up, brings you to this room where you will proceed to get ready for your surgery. You will take off your outer clothing and put on hospital clothing. Everybody knows how lovely they are. They haven't changed at all.
All right, note to file, we need some new gowns.
Yeah. So you might notice that we have nice recliner chairs in all our pre-op rooms now. That's new to us. We used to do it we used to get people ready on a stretcher, but this is much more comfortable. Most people like to sit up. So the day surgery nurse has a computer. She talks to the patient, gets all their history, any medication that they're on, takes their vitals, and then they'll be ready to be seen by their surgeon and anesthetist, and the OR nurse will come and take them into the surgical room.
All right, so let's just recap. So I've come in here, I've got my instructions, I've got new clothes on, and I'm ready, and they've okayed, made sure I'm the right patient, we got the right procedure, that I'm safe to go, and then somebody's going to escort me. What's the OR team doing at this time?
Well, they're getting ready. First thing in the morning, the OR team has a huddle, and they discuss the case coming up, if there's anything important like positioning, medications, allergies, all that sort of thing. So while the patient's getting ready here, the team prepares the OR room and has a huddle, as we call it. Then each one of them visits the patient before they go in for surgery, and the nurse from the OR comes, checks your armband, checks your chart, and away you go into the OR.
So I know a little bit about the huddle, and we got some other people here that could probably tell me more, but my understanding around the huddle, it's a patient safety best practice, is that correct? And what we're doing there is we're ensuring that everybody's ready for the surgery, we have the right patient, we know what we're doing, all the equipment's in the room, and anybody is allowed to comment if they think they're not comfortable for the surgery to proceed. Is that correct?
What you're talking about is a surgical safety checklist, and we do that when the patient is in the room.
Oh, even better. So they
Yes.
huddle beforehand.
They do.
Thank you. And so if I'm a patient, will I actually get to hear all this?
Yes.
Okay, so if they said, we've got Bob here, I can put my hand up and say I'm not Bob. Is that how it works?
Yes.
Okay,
He could.
good. Staff as
Yes.
well. Is that correct?
Yes.
Okay,
We
very
put
good.
a lot of thought into flow for the nurses, you know, going from one thing to the other, clean your hands, get your gloves, go to the patient, where we've got things placed. So we've put a lot of thought into that as well.
And Chris, I know particularly we want to thank you because you were quite involved in the design of this with other people. Is that correct?
That's right. But it's amazing what you do at the last minute. That was planned 4 years ago. We didn't plan for glove boxes and that sort of thing. You know, we planned for the general flow, but now we're down to the small things that are important to the everyday workings.
Great. And do you think this will be a better work environment for the staff?
Oh yes, they're very excited. We've been doing tours and we're doing training this week, so they're very excited to start working over here.
Great. Thank you.
And you'll see each sink, each room has its own hand hygiene sink, each day surgery room, and both ends of the nursing station have hand hygiene, and there's multiple Purell containers.
Come in here, I'm recovering. And what's happening in this space for me?
So when you're wheeled in, the anesthetist comes with you, and one of the nurses from the OR, they give report to the PACU nurse who hooks you all up to your physiological monitor. And these are really great. So now, these little pieces come with you from the OR, and we just snap them in. So it has all your data from your surgery, all your physiological data. It comes right on here, so you can look at what was going on in there as well.
So let me understand that. So that's sort of a plug and play. So
Yep.
this piece here, where all my wires would be attached to, comes with me from the OR.
That's right.
And by bringing it with me, it transfers the information that happened to me in the OR here.
Yes.
Oh,
And
that's
you don't
pretty neat.
even have to take off your blood pressure cuff,
Right.
your EKG monitors. It stays with you and comes in here and gets plugged into this.
Okay.
So then the nurse, you'll probably be already brought up on the computer. And you will have your admission to PACU, all the information and data. You also will have your chart from the Innovium, which is the anesthesia machine.
Right.
Comes with the anesthetist does that. It prints out at the nurse's desk, and one of the nurses will bring it over to be right here with you.
So Chris, I mean, I've had a chance, and I mean, we got some, and I'm not a surgeon, I'm an emergency physician, but I have wandered into the PACU once or twice. This looks a lot different than the old PACU at the Dartmouth General.
Yes,
I mean, it's newer, it's brighter, it's cleaner,
exactly.
and it seems to even be more spacious. Is all that true?
It is. It's very spacious.
Okay,
It's
great.
very streamlined as well as being spacious, so that everything is at your fingertips.
Great, great. So efficient for the staff and hopefully more pleasant for the patients, right?
Very pleasant for the patients, yes.
Good. Okay. So so it's Dr. Todd Howlett. I'm the interim zone medical director for the zone, and the chief of staff at Dartmouth General. With me is the interim chief of staff, because I'm on the other job, and the site chief of surgery here at the Dartmouth General. So Scott, we're sitting here in what will soon be your new PACU here at the Dartmouth General, and wanted to maybe bug you and see what you thought about this new space and what effect it'll be for your patients. When do you next operate, Scott?
I operate next Monday, and it'll be using part of this space. But this is a beautiful new space, nice and bright for the patients with all the new equipment. And this is a brand new piece of equipment. When the patient comes out of the OR, as Dr. Howlett was saying, we can plug and play into there, and all of their OR experience will be displayed. Everything is brand new in this environment, and all the surgeons and nurses are looking forward to it.
Yeah, and I think, we're recognizing that one of the complexities of the Dartmouth Journal is we're renovating the space we're living in. This is another big spot, and we have the brand new ORs. Some of them were being used for this space, and now we're reclaiming those ORs. And when do we think they'll be reclaimed so that we can have all brand new ORs here at the Dartmouth Journal?
So the plan is in about 6 to 8 weeks. Currently, we're using some of the new ORs for the post-anesthetic care unit, which is this space. So as soon as we open this space up, we're going to start working on that space, converting it into our new ORs. So in about 2 months' time, we should have 3 brand new ORs to operationalize.
Great. Well, I mean, this looks, as I said, I think you and I have met once or twice over a stretcher, perhaps in the PACU, and this certainly looks very different than anything we had before. So it's nice to see another part of the Dartmouth Journal get this modernized, and without the donors that have helped us this far, there's no way we would have got to this. So as of Monday next week, people will be using this space. Is that correct?
Yeah.
Correct.
Gordon's the pretty new, director at the Dartmouth Journal, and he co-leads presently with Scott Maudsley as the site medical lead or chief of staff. And we were talking earlier, Gordon, there's this virus that's swirling around us called COVID, and it's caused us to have to change many of the things we do, as many of us know. And we're at a particular interesting phase whereby we want to maintain all our services, at the same time respond appropriately for when we need to around COVID. So maybe, I think you guys have had some ideas about how you might use this space if things start to heat up around COVID, which, knock on wood, we're fortunately not at right now. But I think one of the reputations of Dartmouth Journal is it innovates and is flexible and can change quickly. So maybe you can talk a little bit about what this space might be used for.
Thanks, Todd. So as you say, this is not just a big, beautiful new recovery area for the big, beautiful new OR, but it's also from a site perspective and a systems perspective, as Dr. Howlett suggests, we don't want to reduce services in the hospital. So if we happen to have an overcapacity of patients due to COVID or any other health concern, we've developed a plan to use between 6 and 8 of these recovery room beds as overflow for the inpatient wards. So that would mean that our staff from the inpatient wards would come down here and staff these beds and care for patients that were either medicine patients or post-op patients, or potentially some long-term care patients that have been staying in the facility longer than normal based on some COVID issues or other health issues. So the space would be great use of the space for our staff upstairs, in partnership with the peri-op team and Todd's team at the zone, so that we can properly plan to house as many patients as our facility could hold.
Yeah, no, I think, it's the long time since I've been here, and I'm so proud to see it happening, continue to happen, is the site really responds together under any sort of threat or challenge. And we have this new facility, we're going through construction, it's a tough time, and you've already come up with a plan that if we need more space, we're going to use some of the new space to help for that. So well done to you and to Scott and others. So thanks very much for doing that. Really appreciate it.
So Chris, tell us about the future. So how is this new development positioned for the future?
So as we were making the plans to build the new area, we think we've added a lot of things like data ports and electrical, which you can see here. Most of our equipment as it comes in needs to be hooked up to, it needs data. It feeds right into data, like our glucometers and many other things. So as we were making the plans for it, we've included extra data and electrical for those things.
Todd, that was really wonderful. Chris, amazing. Maybe Todd and Gordon and Scott, maybe tell us what's next for the project. What's next? What's our next big milestone coming up for the redevelopment?
Yeah, no, I think what I heard these guys were talking about, I mean, the next part is we got to finish operationalizing the entire OR. So the ORs that we had out of action to use as a temporary PACU come back online. And the ultimate flow, as Chris was talking about, that will be here, will be established hopefully about 6 to 8 weeks from now. And there's some other big things happening in the hospital. So Gordon or Scott, maybe you'd like to talk about what's happening in radiology or X-ray department.
Sure. So radiology is moving into a new space, and once again that presents some challenges because we're renovating while we're using the space. So we've had to shift people into temporary positions, and in the next few weeks we'll be opening up the permanent areas for radiology.
Great.
The other big piece, I guess, following on to that is we'll have a new intensive care unit down on the main floor next to Emerge. And that will create a capacity to have an intermediate care unit, which is like a step-down intensive care unit. So that will be up in where the old ICU is, down the road.
Yeah, so I mean, I think when you come to the Dartmouth General right now, as many of you know, you see a different entrance. And beyond that, we're renovating the guts of the main floor. So big changes, that's where our DI department is. On that floor is our new ICU, and it's pretty exciting. So I think each time you come here every week, you'll see something new, and it'll just keep getting better.
Thank you very much for joining us on this tour of the behind-the-scenes look of our next big milestone here at the Dartmouth General. Thank you so much to you as our donors. You've helped us make this become a reality. You saw the new equipment, the new beds, the new technology, and that's been the focus of our campaign. So thank you as donors for making this next big milestone in Dartmouth General Hospital's history happen and become a reality. I wish you could be here in person like we normally would do in terms of a personal tour, but stay safe and we'll be together again very soon. Thanks.